Good afternoon, everyone. Before we give the official COVID-19 update, I just wanted to say that ahead of the state budget tomorrow, how pleased the New South Wales Government is able to say a big thank you to all of our frontline workers and all of our public servants who have been just amazing during this most difficult time for New South Wales. And in doing so, I want to thank the Treasurer for making sure that the New South Wales Government is able to now pass on a 2.5% wage increase for them. The New South Wales Government employs 400,000 public servants across the state. Each and every one of them have been critical for us during this period. We appreciate the sacrifice everybody took last year, and now we're really pleased to be in a position where we can reinstate those wages. And as you know, the New South Wales Government wages policy means that if categories of workers come to us and want higher than the 2.5, if they present a case where they're able to show additional efficiencies or show additional ways in which they're making a greater contribution, well then that can be assessed as well, and that's consistent with our wages policy. But I just wanted to acknowledge all of the public servants across the state, in particular the frontline workers who've been outstanding and continue to be outstanding. I know that for many in our ranks, fatigue is becoming an issue, and we're deeply grateful that the depth and breadth of our employees means New South Wales can always be on the front foot, not only in the war against COVID, but also in making sure that we transform our state and ensure that economic activity and growth continues. Dr Chant will give a quick COVID update after I finish my remarks, and then the Treasurer will give an update on the wages policy as well. But as has already been reported at 11 a.m, New South Wales has an additional 2 cases beyond the 2 that were reported to 8 p.m. yesterday, and Dr Chant will provide an update on those additional cases. Both are already in isolation, both are close contacts of existing cases. Whilst this isn't a bad outcome, our level of concern is still there, and I just want to foreshadow that it's likely that beyond Wednesday midnight we will continue to have the existing settings in place. We had said that the existing settings would be in place until Wednesday night or Thursday morning midnight. However, given the situation we're in, and given that we don't want to see further restrictions imposed more broadly across our cities and our state, that in all likelihood the existing conditions or the existing settings we have in place are likely to continue beyond the initial 5 days that we had asked people to do. In relation to testing, it was a cold weekend yesterday. We did get more than 25,000 people for testing, but notwithstanding that relatively okay number, we want that rate to be higher. We will have confidence in our policy going forward in relation to the current settings going forward if those testing rates go up. Please, please, if you've been asked to get tested, do so. If you have the mildest of symptoms, do so. If you've been to a venue of concern, please get tested. The higher the testing rate, the more we're able to move forward confidently and reassuringly that the current settings we have in place are adequate. So I really ask everybody to do that. But having said that, many people have taken it upon themselves not only to take on the health advice, but also to restrain their activity, as we've asked people to do, to refrain from large gatherings unless it's absolutely necessary, and to make sure that everybody takes care. When you leave your house, when you leave your home, at any time of the day, you have to assume that you or somebody in close proximity to you has the virus. And we know from the number of cases that we've seen already in this particular cluster that in some instances the exchanges have been scaringly fleeting. Literally people coming within, not even physically touching each other, but literally fleetingly coming into the same airspace has seen the virus transfer from one person to another. That's how contagious it is, and that's how contagious some people are. So notwithstanding all of that, we want people to make sure that they're following the health advice, that the current settings are respected, but also that you consider your own personal behaviour depending on where you live and what your circumstances are. And we do envisage that the current settings will continue beyond the time frame we'd set out, and Dr Chant, myself and the Minister will have more to say about that tomorrow. I now ask Dr Chant to say a few words, and then the Treasurer will say a few words, and then of course we'll take your questions. Thank you.
Thank you, Premier. So the media release today indicates these cases, but I'll take you through them. We had 2 locally acquired cases reported to 8 p.m. last night. One of them was a woman in her 50s from Sydney South She's a close contact, a family member of a previously reported case and has been in isolation. And yesterday we'd mentioned she lived in Sutherland Shire. She actually lives in Sydney South, so very close by Sutherland Shire. And one gentleman in his 50s from the Sutherland Shire, he's a close contact of a previously reported case and has been in isolation. There is a transmission event at the Salvation Army store in Tempe, where an infectious case attended on the 16th, and obviously we have identified today in the media release as well as last night that if you attended the Tempe Salvation Army store on Thursday the 17th of June and Saturday the 19th of June, anywhere between 9 a.m. and 5 p.m, we're asking you are a close contact and you must immediately get tested and isolate and remain in isolation for those 14 days. And I also draw your attention that you're also a close contact if you were there on the 16th of June when the infectious case attended, and that was the time where we believe transmission occurred. And so it is important that anyone that was there between 9 a.m. and 10:30 or 2:15 to 2:45 on the 16th of June, please check and remember what you did and your times that you attended that venue. If you fall in those time frames, please, you are a close contact. Immediately get tested and isolate if you are not already doing so. In relation to the cases that came in overnight, one is a woman in her 50s from Sydney's northern suburbs, and she's a close contact of a previously reported case and has been in isolation. And we also have one man in his 30s who's also a close contact of a previously reported case in isolation. And I think this is actually a positive sign if we continue to see that the cases are emerging, particularly if people are in isolation for the full period. We're just confirming the robustness of the isolation with those two individuals that have become positive, but that's an optimistic sign. We do need to maintain those high testing rates, and what we're hoping is that the list of exposure venues does not grow. So please, can I urge you to check those exposure venues? They have been regularly updated, and just because you've checked at one point in time, the information on that website may have changed. Thank you.
Well, thanks, Kerry. Today, as the Premier has pointed out, we're announcing our new wages policy, which will be 2.5% each year over the forward estimates. And we made the decision last year, and it was a difficult decision, to pause public sector wages at a time when the state was facing a potential 15% unemployment rate. We all saw those confronting signs of many people standing outside Centrelink queues. Many people lost their jobs, and ultimately many people took pay cuts. But we always said at the time, when the Premier and I spoke at the press conference last year, that when we could return and increase wages, we would. And at the start of this year's budget process, the Premier and I had a conversation in relation to where we could go with public sector wages. And a lot of that depended on where the financial position of the state was. And this is one of the final decisions we made, and we made it. We shot early on to see what we could increase it to based on the financial position and trajectory of the budget position, particularly in the final year of the forward estimates. And I'm pleased to say, because of the investments in the stimulus that we have made and the success of the economy here in New South Wales rebounding back, we've been able to lift wages to 2.5%. That's at a substantial cost to the New South Wales budget of $2.7 billion over the next 4 years. Obviously, this is by far the most significant investment in this year's budget as a one-off announcement. And we've been able to do it because of the strong foundations that we made, the stimulus measures, our focus on keeping businesses in business, on people in jobs during this period of time, has ensured that the budget has rebounded. The trajectory that we've set for the New South Wales budget is where we want it to be. And at the same time, we've been able to make this decision because at the start of the process, where we are in the final year, was the goal that the Premier and I had set in relation to setting up the budget. So today is about thanking the public servants right across the state. As the Premier has said, 400,000 public servants. We're the largest employer in New South Wales. And when the CPI is around 1.7, to be at 2.5%, I think is a very strong indication of the strength of the New South Wales budget, a strength of the New South Wales economy. And the reality is, when the economy goes well, the budget goes well. We made a decision to not go in a structural deficit. to drive, to make sure that our economy continued to grow and to get our budget back on track as quickly as possible. And here we are, 12 months later, probably less than 12 months later from last year, to be in a position where we're able to return to 2.5%. That is a sign of success. If you look around the country, there are very few states providing 2.5% pay increases for their public service. Most states froze public sector pay last year and continue public sector pay freezes into the future. So this is a sign of confidence in the people of New South Wales. It's a sign of confidence that the budget and the economy is back on track. That's what you'll see in the budget tomorrow, and I'm very pleased to be here with the Premier today to provide this extra support for public servants right across New South Wales.
Treasurer, can you just confirm, under the previous policy was up to 2.5%, and the
Yep.
wording here is up to 2.5%. So can you confirm the 400,000 public servants will be getting 2.5% each year for the next 4 years?
Yes.
All,
Yes.
all public
Yeah,
servants?
it's 2.5% for public servants each year. The regulation that's that is in place at the moment is up to 2.5%. Obviously, we paused pay rises last year. This is 2.5%, but as the Premier correctly points out, we've always said if there are productivity savings that various areas of the public service can come forward for pay rises above that 2.5%. So we will be providing 2.5%. The policy is up to 2.5%, but the regulation is up to 2.5%. We're saying, as part of our policy, we are providing for 2.5% pay rises each year over the forward estimates.
Could you review that in 2 years? If it's given it's 4 years, could you review that in 2 years and go?
No, well, this is our commitment. I mean, every budget, you look at these things, but we've locked in the budget numbers are banking in 2.5% pay increases for the public service each year over the forward estimates.
Treasurer, paramedics wanted 4.5%. In New South Wales, they're among the lowest paid in the country. Why is that?
Well, that's taking a point of comparator and comparing it at something which is not necessarily apples for apples. So I'm continuing to work with the paramedics. I spent an hour with them a couple of weeks ago. Their issues are broader than just simply their pay increase. There are productivity issues that they don't believe that they are being rewarded for or being acknowledged as part of those extra pay you can get above 2.5% in circumstances where productivity savings are found. I've said to Gerard Hayes, the head of the HSU, I'm very happy to sit down with him. I'm waiting to hear from them in relation to getting further details around the specifics of those issues, and we'll work through it. But we want let's not forget, as I said today, we are one of the only, one of only 2 states that are providing 2.5% pay increases. I think Queensland is the only other state. Western Australia, pay freezes. Victoria's down to about 1.5%. There are pay freezes right across the country right now in the public service. And so this is a strong sign that the New South Wales economy is back on track. And this is what we committed to doing. We are just honouring the commitment we made last year. And that was when we got back into a financial position where we believed that we could afford an increase in public sector wages, we would, and we've done it within 12 months. It's a vindication as well of our policies. We made those decisions so we could invest in stimulus to grow the economy, to keep people in work. We took down the unemployment rate. Even in the budget last year, we were looking at 7% in the December quarter. We are currently down to 5% here in New South Wales. That is what success looks like. We made that the goal, we've achieved that goal, and we've been able to increase public sector wages ahead of where I thought we could have.
You talk about the economy being back on track. We've seen a number of announcements over the past few weeks about what will be in the budget tomorrow. Can we get a sense of the theme or what will really be in the budget tomorrow?
Well, I think you've been seeing the thing. I mean, we are one of a few governments, I believe, around the world that is not just dealing with the here and now. Yes, we have a focus to keep our people safe. And that's exactly what we're doing, record investments in health. The strong foundations that we have laid over the last 10 years have put New South Wales in an incredibly strong position to manage this virus really well on the economic and the health side. But this budget isn't just focused on the here and now, it's about setting ourselves up for future success, for your family, for your children, for greater opportunity and prosperity into the future. And that's what's going to set aside good governments during a pandemic and bad governments. One that delivers for today, but also sets the state up for future success. And that's exactly what we're doing. Yesterday's announcement in relation to electric vehicles, that's significant reform, abolishing stamp duty, but also bringing forward the next generation of vehicles into New South Wales. We are setting up a cleaner, greener future here, and we are ahead of the curve right across the board. So yes, there's a focus on today, delivering for families, meeting them where they are, supporting families with cost of living measures, improving quality of life, but ultimately also, with one eye on the future, setting up our state for success. And that is what you're not seeing around the country. If you look at the other state budgets, they are increasing taxes and cutting spending to get their budgets back into shape. We don't have to do that in New South Wales because of the strong foundations that we've laid. We are not cutting back. We are investing more in people right across the state and building a brighter future for New South Wales with a record $108.5 billion infrastructure investment over the next 4 years. And if you look at schools and hospitals, particularly a school building program, it is the biggest state school building program in the history of the country. And that's what we're embarking on now, and that just shows we're not, yes, we're focused on meeting families where they are. You will see that, but you'll see one eye on the future.
The fact that international travel is not resuming as quickly as originally forecast, the vaccine rollout nationally is slower than anticipated. What effect is that having now on the budget?
Well, the assumptions that are made in the federal budget, we obviously adopt if they're matters outside our control. So, we were focused earlier on international borders being open to December, and we've said in our state we want international borders to open as quickly as possible. We can't live here on the other side of the world in the hermit kingdom while the world moves on. And key to that is the vaccination rates. And that's why New South Wales Health is doing an amazing job in getting through the vaccination program as quickly as possible. And that's what we need to get to. I've always said the federal government should set targets. They should let states know what those targets are. And even if we fall short, that's okay, but at least we know where we're going. Otherwise, the country can meander through this situation.
But there were targets when you did the last budget 9 months ago.
Yeah, well, they've delayed that. They've delayed that target to from December this year to mid-June next year, and obviously that has impact, which will be disclosed tomorrow. But ultimately, let me assure you all, where we were last year to be in a position today where the budget is back on track. Where we're able today to sit here with a significant $2.7 billion investment over the next 4 years in the budget and still be where the Premier and I wanted to be in that final year of the forward estimates is testament to the strong financial position of the state. To be in a position where last year we were seeing those confronting signs of people lining up outside Centrelink, something that I've never witnessed in my lifetime. To be in a position now where the biggest issue in New South Wales when you speak to businesses is skills and labour shortage, which goes to the point in relation to international borders. I think you can say that we're blessed to have that problem than to have the other one.
Had you presented this pay deal to the HSU? Sorry, had you presented this deal to the HSU before today? And what's your reaction to the fact that it appears they are going to continue with their planned industrial action tomorrow?
Well, I'm always very disappointed in circumstances where industrial action takes place if that affects people. But I believe today this is a testament to our financial management. The Labor Party like to talk about concepts. They would love to sit here and say, we'll give you 10%, but they can never pay for it. The reality is we are in this position today to get back to 2.5% within 12 months because of the strong economic recovery here in New South Wales. And I want to pay credit to the Premier and the Health Minister and the Chief Health Officer, Kerry Chant, because what's underpinned our response and our economic recovery has been our health response. That's allowed us to open up. And the economic return of this state, the return of the state's finances back to where we wanted to be. And as I said, when we looked at the budget position, the Premier and I at the start, we both set a target and said if this is where we can get to in the that's our target in the 4th year. We've been able to get it and get back to 2.5% pay increases within 12 months. That's success.
Premier, in regards to National Cabinet discussions on COVID-19, were you able to convince the federal government that New South Wales should get additional shots of the Pfizer vaccine beyond what had already been
Well, certainly the information that was provided today confirmed that states are receiving vaccine doses according to population, which was a relief. So looking forward, all the states will be receiving doses according to their population. But obviously, we remain, as the Treasurer has said, New South Wales remains with a sense of urgency in relation to the vaccine rollout. We're limited because we can't control supply, we can't control the doses we get from the Commonwealth. What we can do is support them in getting the doses out the door. And what we highlighted today, what New South Wales highlighted today, was also the need for the federal government to increase the capacity of the GP network. We need more GPs on board. If we are to get all the doses which the Commonwealth is saying we're going to get, we will need more GPs on board, as well as our health clinics doing more as well. And pleasingly, the New South Wales health clinics have been able to do more, but I know GPs are very frustrated. There's a number that want to come on board, there's a number that want to do more, and we need to make sure that we increase that capacity so that when those Pfizer doses arrive, that we have the capacity to get them out the door.
Premier, the military commander in charge of the vaccine rollout, his name I've forgotten about, he said this afternoon the states and territories didn't make any specific requests for dosing today at National Cabinet in relation to requests for more Pfizer. So did you ask for more Pfizer?
Well, we got updated information we hadn't seen before on the doses we're getting, and the Prime Minister confirmed that every state was getting doses according to their population.
You didn't ask for any more?
I don't know where you've been, James.
Is there a national supply crisis in terms of the Pfizer vaccine?
Well, obviously, the Prime Minister and the federal government have outlined their plan for how many doses we're getting in the next few months. Obviously, towards the end of the year is when those massive doses of Pfizer arrive, but we need to make sure we're ready for that. We need to make sure that we have capacity through the GP network to deliver those doses. But I also really want to call out to everybody, if you've had the first shot of the AstraZeneca, please get your second one. Because if you've been okay after your first one, the health advice suggests that you'll be okay after your second one. So can I urge everyone who's had their first dose of AstraZeneca to get their second dose? I certainly have, Dr. Chant has, and we recommend everybody else who's had that first dose to definitely get their second dose.
Dr. Chant, if I could ask you, we understand there's a building on George Street that has 16 floors that have been put on alert, and all staff who were there Tuesday, Wednesday last week have been told to get tested and isolate. Can you confirm if it was a cleaner that visited those 16 floors?
No, it's not related to a cleaner. It's related to an infectious person who was at that premise. Close contacts associated with that individual workplace, close contacts were called close contacts and required to isolate for 14 days and have undergone testing. And in relation to some floors, as a precaution, because obviously it's impossible to know who was in lifts when people are moving between a set of floors, those individuals have been asked to get a test, and the rest of the building has been asked to monitor for symptoms. So this is our usual approach, where we work with the business to understand the risks associated with any infectious person.
So it was more precautionary, not that a single person visited all 16 floors?
That's correct. So the concept is sometimes it's impossible to know who has gone up and down lifts. That was assessed as a risk. Because we couldn't do that, for the abundance of caution, we've called out the floors that are associated with that particular lift journey.
Dr. Chant, do you think it would be of benefit to you if the state government made QR code check-ins compulsory for all retail settings?
So the issues associated with the QR codes is we've actually got a great rollout, and I can't thank Service New South Wales enough for the support. And what's really useful is that health staff have got ready access to that. Obviously, the QR codes are really very useful in particular settings. But we also know that in some smaller grocery shops and other things, the issues associated with queuing mean that you'd end up having queuing and other risks. So we have taken very much an encouragement where we require, encourage retail and grocery shops to think about how they do it, but they're also, essential goods and services, and we don't want to add other risks, but we welcome people working through those. And we're really pleased that big premises and small premises have all done their part in determining what's the best way to understand their clientele. We also want to extend our appreciation because centres have used, for instance, loyalty cards, rewards cards, other customer lists to get messages out. So this all helps us, but it does require the community to be particularly alert at this time. The information is changing, so please just keep up yourself. keep up to date by going to that website. Save it as your favourite, and can I just get people that are moving around in those at-risk areas to just check that website every morning before they set off.
Premier, have you been given an update on the police investigation into the airport driver? Is there any new details coming out there in terms of what regulations may have been broken?
Look, I haven't received any update yet, and look forward to doing so. And just for background information in relation to vaccinations of categories of workers, last National Cabinet, not this one, the National Cabinet asked the AHPCC, which is the federal health body, to look at the issue of aged care workers and disability workers and to what extent compulsory vaccinations could be made available there. The issues are rather complex, so based on that advice, we will consider our options moving forward in terms of compulsory nature as well.
Premier, on the weekend your office confirmed that you're in a new relationship. I've got a personal question for you. Are you hopeful that you'll be able to avoid the scrutiny that your last relationship faced?
No comment.
Premier, what attracted you to Arthur Moses?
Well, sorry?
What attracted you to Arthur Moses?
No comment.
Premier, are you concerned that some of the inconsistency in the messaging around mask rules is causing confusion among hospitality venues and patrons?
Oh, look, I'll ask Dr. Chant to provide an update on that because she's across the detail. But I want to say this, that in a pandemic, we've been through this situation quite a few times before in New South Wales, and I think people appreciate when we ask for the compulsory mask wearing, the categories that are there. But I will ask Dr. Chant to clarify that point.
Specifically though, Premier, on the New South Wales government website.
Yeah, that's what I'm asking Dr. Chant to clarify.
So thank you very much. Like, you can imagine that a lot of information has to be updated. We apologise to any member of the public if we are going to tweak the information on the website, on the Service New South Wales website, just to clarify that the reference to the pubs, clubs relates to the requirement for people to wear masks when they're in the gaming sections of those. So basically the rules is in hospitality, if you are serving the front-facing position, client-facing, you need to wear a mask. And also if you're in the gaming areas of any of those facilities, and obviously it extends, there's mask wearing required in entertainment facilities. The reason we've made a practical decision that people are actually in there drinking and then taking the mask on and off poses other risks. But we are asking people at this time, businesses have also put a lot of investment in having their COVID-safe plans, and our other messaging on the weekend was very much ensuring that people look at their COVID plans, but just really tighten the implementation of those. So making sure those QR codes are at the front of those premises, but also making sure that you are taking those opportunities for social distancing, queuing, 1.5 metre distance if you can, and just managing ingress and egress out of those facilities. And we thank businesses for taking the time to do that.
The New South Wales website was changed 3 times in the last 24 hours to get to a point where it was consistent with the public health order, which is the same public health order from Australia we had last time. Why did the Service New South Wales website get it wrong?
Look, we're happy to look into any details and really try and aim to communicate effectively. That information's gone out in our media alerts, and we thank the media for getting that message. If there's been any confusion, again, I can clarify. In terms of hospitality venues, it is the wait staff. And can I just explain to the wait staff, because I myself in a previous time had overheard someone saying that they didn't understand the rationale for that. And the rationale really is that if we have any infected wait staff, they actually in a day encounter a large number of people. And we have seen transmission from those hospitality workers. Whereas if you are yourself in a group, you're likely to stay largely to yourself and they're going to be your close contacts. So that's the rationale. And it's a practical consideration that when you are going out to dining, it's really impractical to have that sip of water, to drink, and to be pulling your mask on and off whilst you're doing that. We are encouraging people to wear masks in indoor settings. We just need everyone to be extra vigilant as we get through this threat. We are not out of the woods yet. The signs that give me comfort are that we are finding people are being in isolation. And we will be expecting more cases to come up, but hopefully those cases are occurring in isolation. But if we see the emergence of any unlinked cases, that is another issue that will cause my concern level to rise.
So do you see the settings increasing? So do you see the settings increasing? The Premier said in her opening statement that at this moment the settings that will continue post-Wednesday. Do you see those settings increasing in terms of their extent?
At this moment, we are just watching every new case that comes in. We forensically examine that case and see what we're concerned about is, additional exposure venues. If we have issues that there are cases that are unlinked, indicating that there's chains of transmission we have yet to detect. So this is a critical part in the response, and I know I've used that word before, but it really is critical that we all do our part in moderating our behaviours, taking that extra care, and that applies to individuals but also businesses.
Dr. Chant,
Sorry,
Last
sorry,
few
just
questions,
on the
please.
work from home instructions.
So that
You
was-
ask people to work from home.
okay.
Who does that?
No, so the work for home issue. So what we wanted to do is provide no disincentive to anyone at Bondi Junction. So we have been concerned about transmission at Bondi Junction. We know that there's been 3 people that have been exposed both on the 12th of June and the 13th of June. In one, we actually have CCTV footage of the encounter, and it is basically a crossover individuals. They're clearly facing each other, but it is literally someone moving across from each other for a momentary moment. Close, but momentary. And this would be that the point we're trying to get across, and in 2 other cases, we haven't been able to, with the CCTV footage, look at the exact same crossover point, but we know they were like 20 metres signing in at different venues at the same time or in that area, so we suspect they did cross over. So this highlights the fact that transmission in that setting has occurred through this crossover effect. And so we've asked everyone who's been in Bondi Junction on the 12th and the 13th. Initially we started off with the time frames, and that's a little bit confusing because people don't actually necessarily remember the time they were there. We've now said anyone who was there on the 12th or the 13th, go and get a test. And just so that if you were at any venues, you need to isolate in the usual way, or if you're casual contact or close contact, follow the public health advice. But this was casting a wide surveillance net to make sure we weren't missing anyone. And because of that reason, we didn't want any barriers. So what we just asked those individuals to do is, just while you're waiting for your test result, just if you can work from home, work from home. If you can minimise, don't go out to the pub or have a big, gathering whilst you're waiting for that test. But we weren't imposing the strict isolation requirement waiting for that test result if you didn't have any symptoms and you hadn't been in any close or casual contact venues.
Dr.
Last
Chant,
question,
this is the
please.
Delta
So it's not a
variant.
general. So it's not a general guide to work from home. Yeah.
Dr. Chant, this is the
Last one,
Delta
please.
variant, which is meant to have a higher infection rate. We've been talking about fleeting moments of transmission. In your opinion, why aren't we seeing this thing explode compared to, say, the Avalon cluster?
It's too early to see, and this requires us to respond. We are taking this threat very seriously, and we're asking the community to do so as well. We are not out of the woods yet. We need to sustain that behaviour change. We need to get those testing rates up. But it is, I extend my gratitude for the people that have come forward, got tested. If those individuals had not got tested, you can see how easily chains of transmission. I think from one person alone we've had, 4 or 5 cases, and then those 4 or 5 people, if they weren't recognised, go on and infect another, even if they infect 1 each or 2 each. You can see how it grows exponentially. And that's why this is such a critical phase where we need to find all the cases and make sure we identify the close contacts and casual contacts, and then hopefully if there's going to be further transmission, that transmission event occurs without any further exposure to the community. And that's the purpose of the public health response.
Great. Thanks, everybody. Thank you.